Good day, sir. I am Chris Model Tayopon, your nursing aide for today, and today we're going to demonstrate administering oxygen using nasal cannula. So, the purpose of this procedure is to deliver relatively low concentration of oxygen with minimal oxygenation support required. Also, to allow uninterrupted delivery of oxygen while the client is ingesting fluids or foods. And for the equipment needed, oxygen supply with flow meter, then humidifier with distilled water, or according to agency protocol, nasal cannula appropriate size and tubing, and no smoking sign and oxygen use sign goes to padding. Then for assessment, observe the client for any signs and symptoms associated with hypoxia, such as cyanosis, breathing pattern, lung sounds, chest expansion or chest movements, and apprehension, also the decreased level of consciousness. Then for next, review the client's medical record for the order of physicians for oxygen therapy. Note for the oxygen therapy method, the flow rate, and the duration of oxygen delivery. Then for planning, assist the client in semi-Fowler's position because it permits easier chest expansion and hence easier breathing. So, excuse me, sir. Can you help yourself up? Please lay down. Thank you. Next, introduce self and verify the client's identity and explain the procedure to the client and to the family what we are going to do, what the procedure entails, and why are we going to do it to the client. So, good day, sir. I'm Nurse Model, your nursing aide for today. May I know your name?
My name is Joshua.
Okay, thank you, sir. Do you know where you are now?
Hospital.
Okay. This procedure, oxygen therapy, we are going to do, sir, to help you better lung sounds and to help you breathe easily. I hope you can cooperate with me until the end of the procedure. Thank you. And the next, review for safety precaution when oxygen is used. So, place the no smoking sign and oxygen use at the entrance of the room and also at the head part of the bed of the client. Then next, mm, um, perform hand hygiene and uh, put PPE if indicated. Afterwards, we are going to provide privacy by closing the curtain around the bed and close the door if possible. Then obtain all necessary materials at the bedside of the client to save time and effort. So, next for implementation, we need to set up the oxygen equipment and humidifier. So, attach the flow meter at the oxygen tank or in the wall outlet. Then, flow meter should be in off position. Next, the humidifier should be attached at the base of the flow meter. Then, fill the humidifier if needed. Then, attach the uh, prescribed oxygen tubing with the delivery oxygen device at the humidifier. Then, turn on oxygen. Ensure the oxygen functioning by using the oxygen tubing into the posterior of the forearm to feel the release of oxygen. Afterwards, place the prongs into the client's nostril. the tubing should be at the either side of the uh, client's ear. Then the adjuster should be uh, in the chin of the client. If the tubing is moving, we need to take it. Afterwards, please pad either hair of the client to avoid irritation. It should be at the cheekbone on either side for the both of air of the client. Then encourage the client to breathe through the nose and close the mouth. Then reassess the client's respiratory status such as respiratory rate, lung sounds, the effort, and note for any signs of respiratory distress such as tachypnea, nasal flaring, accessory muscles, and or dyspnea. Afterwards, remove PPE if used and perform hand hygiene. After performing hand hygiene, put on gloves. Remove only and clean the nasal cannula. Assess the nares for at least every 8 hours. According to hospital agency's recommendation, and assess the nares for any irritation and bleeding. For evaluation, reassess the client to determine the client's response towards the oxygen therapy using oxygen cannula mask. So, sir, are you all right?
Yes.
Okay. Afterwards, for documentation, document or record the therapy from the beginning until the end of the therapy, in also the nursing shift. Then in the nursing shift report, include the oxygen therapy, the respiratory assessment findings, oxygen delivery method, flow rate, the client's response, also the adverse reaction or any side effects from the clients. Then next, remove gloves. For our next procedure is oxygen therapy using face mask. So the purpose of this is to provide moderate oxygen support and a higher concentration for oxygen and humidity more than the cannula is provided. Then for the equipment, oxygen supply with flow meter, humidifier with distilled water or tap water according to hospital's policy or protocol, and goose pad and gloves. Then for the assessment, observe the client for any signs and symptoms associated with hypoxia such as cyanosis, breathing pattern, lung sounds, chest movements, apprehension, and decreased level of consciousness. Next, review the hospital record of the client, the medical record for the order of physician, note for the oxygen delivery method, flow rate, duration, and the duration of the oxygen therapy. Next, for the planning, assist the client in the semi-flourish position because this position permits the client chest expansion and hence easier breathing. So, excuse me, sir, can you help yourself up? Please lay down. Thank you. Afterwards, introduce self, verify the client's identity. And good day, sir. I'm Nurse Madel, your nursing aide for today. And may I know your name?
My name is Joshua.
Okay, thank you. Verifying the client's identity to prevent any misinterpretation or any missed patient like that. So, then explain the procedure. This procedures are oxygen therapy using face mask. So this will help you breathe more than the cannula can help you. So more oxygen for you. It helps you to easy breathing and next explain why we are doing this and what we are going to do to the client. So after that, review the safety precaution when oxygen is used. Place the sign no smoking and oxygen in use at the entrance of the room and at the head part of the bed of the client. So next, perform hand hygiene and put PPE if indicated. Then after that, provide privacy by closing the curtain around the bed and also close the door if applicable. Then obtain all materials needed at the bedside of the client so it will save time and effort. Next, for implementation, um, adjust, open the oxygen gauge and adjust to the prescribed by physician. Then, check for the adequate flow of oxygen in the tubing by using the posterior aspect of the arm. Then, guide the face mask into the face of the client. Make sure to fit it so that only a small amount of air can escape. Then the rubber band should be behind the uh, head of the client. Then if it's not, then place some padding either each hair to prevent irritation. Then afterwards, encourage the client to breathe through the nose while the mouth is closed. Then reassess the client's respiratory status. The respiratory rate, the nasal flaring, the effort, and note for any signs for respiratory distress such as takip niya, nasal flaring, use accessory muscles, and or dyspnea. Afterwards, remove PPE if used and perform hand hygiene. After performing hand hygiene, put on gloves. After done gloving, remove and clean the face mask. Excuse me, sir. Then, assess the NARES for every 8 hours according to agency protocol or recommendation. Then, assess NARES for evidence of irritation and bleeding. Afterwards, for the evaluation, reassess the client to determine the response towards the procedure, use oxygen therapy using face mask. So, sir, are you alright towards the procedure?
Yes.
Okay. Afterwards, for documentation, record in nurse's notes from the beginning until the end of the nursing shift. Then, in the nursing shift report, include the following: the oxygen therapy, respiratory assessment findings, oxygen therapy method, flow rate, and client's response, adverse reaction, or any side effects we observed from the client from the beginning until the end of the procedure. That's all. Thank you.